My name is Mayam, and the microorganism I have chosen to speak about is Mycobacterium tuberculosis, which causes the disease tuberculosis or TB. Tuberculosis is a respiratory disease that is prevalent worldwide and can affect everyone of all ages, or it's more likely to be more life-threatening for kids who can develop more life-threatening forms of TB at a younger age. And it is currently one of the leading causes of death globally by an infectious disease and has been estimated to have been around for 3 million years. Currently, people are tested for TB through skin tests, and in 2021, the United States local and territory health agencies reported a total of 7,882 cases of tuberculosis to the CDC, where 317 of those cases included children of the ages of 14 and below, where overall 4% of reported cases of tuberculosis in 2021 included children. Where this chart from the CDC depicts the details about the TB cases in the United States in 2021, which depicts the ages and the genders of those impacted by TB. Mycobacterium tuberculosis can be classified by the domain of bacterium, the kingdom of bacteria, the phylum of Actinomycetota, the class of Actinomycetia, the order of Mycobacteriales, the family of Mycobacteriaceae, the genus of Actinomycetota, and the species of M. tuberculosis. For the nomenclature of Mycobacterium tuberculosis, the microorganism got its name from the Latin root word of tuber, which translates into lump, and the longer root word of tuberculum, which translates into small swelling. Tuberculosis has actually had multiple names over the years, where it was more commonly known as consumption, and in ancient Greece it was known as Thitis, and in ancient Rome it was known as tabs. And then when it was formally named by Dr. Robert Koch, who named the disease after what it does in the body, where Mycobacterium tuberculosis causes swelling in the lungs. Tuberculosis is communicable and airborne, where the bacteria spread through the air when someone who has TB sneezes, talks, or coughs, spreading their droplets to a non-infected person. And then when one person gets tuberculosis, symptoms can include chest pains, a prolonged cough, which can involve coughing up blood and phlegm, fatigue, weakness, weight loss, and a lack of appetite. With this, though, tuberculosis is very preventable, where it can be prevented by proper hand washing and then coughing and sneezing into your elbow to prevent any transmission of bacteria, as well as wearing a mask if you know that you are sick so you don't spread any infection. The article I chose about my bacterium is titled, Mycobacterium tuberculosis mutation rate estimates from different lineages predict substantial differences in the emergence of drug-resistant tuberculosis, which was published in the journal Nature Genetics in 2013. And I chose this article because not only was it very informative on tuberculosis, but it was also informative on how it mutates and just provided insights in general on how viruses mutate and how mutations impact different diseases. In the article, it hypothesized how different strains of Mycobacterium tuberculosis that emerged in different areas have developed different resistance to antibiotics. In the article, it shows research that was done in the study, which determined that strains of tuberculosis that emerged in East Asia were more susceptible to antibiotic resistance, unlike strains of tuberculosis that emerged from Europe and America. And these results came from examining those who had contracted tuberculosis and those who experienced unsuccessful antibiotic treatments where their strain of the bacteria was observed. And in this slide, this chart depicts the resistance that the two different types of strains had on antibiotics that were used to treat tuberculosis, where the strains that had originated from lineage 2, which has roots in East Asia, had more resistance to rifampicin, an antibiotic that is known to treat tuberculosis. In this study, further experiments were also done where different amounts of rifampicin were administered to patients with each of the different strains. With these experiments, they revealed that even altering the concentration of the antibiotics did not prevent the strains from lineage 2 acquiring rifampicin resistance, supporting the hypothesis made, which can be seen from the chart on this slide. And this overall led to the conclusion where mutation strains of Mycobacterium tuberculosis that originated from East Asia or more commonly known as lineage 2, were more susceptible to developing resistance to the antibiotics used to treat tuberculosis. Currently, as mentioned earlier, tuberculosis is still one of the most infectious respiratory diseases, where before the emergence of COVID-19, it was one of the biggest killer respiratory diseases. And in fact, with COVID-19 cases decreasing, tuberculosis cases have been increasing. Approximately, according to a report from the World Health Organization, 1.5 million people die due to tuberculosis, where approximately 4,109 people are impacted per day due to the disease, especially in countries where antibiotics and medicine against the disease are harder to come by. And overall, for tuberculosis, treatment is very difficult, where many people who contract tuberculosis are resistant to the antibiotics that are more commonly prescribed. And until recently, treatment for tuberculosis was very rigorous, where patients who had tuberculosis would have to take 5 to 8 pills per day and a daily injection for an upwards of 2 years, and then that only had a cure rate of 20 to 30%. But however, in 2019, a new drug regimen for tuberculosis was approved by the FDA, which definitely was less rigorous and involved patients taking 3 pills per day for 6 months, which had a 90% cure rate. And overall, tuberculosis could be eradicated and curable, but more time and resources need to be dedicated into finding the cures, which is needed.